Okay, good afternoon, everybody. Hey, I'm here to present about COVID-19 and some of the changes and adjustments made to the school, trying to protect the community, the students, and the staff. I want to welcome everybody back, and it's nice to see some life coming back to the hallways after 6 or 7 months of basically being emptied. I'm going to talk about COVID-19. A lot of this material, it's probably you're already well aware of, but just to reinforce your knowledge, and the purpose of it is to train you so you could train your students and other staff members about proper protocols to follow and what we're trying to accomplish here. So start off with the first slide, just kind of follow along. And basically, as you know, COVID is an acute respiratory syndrome. It's going to affect the respiratory tract. It's basically spread by respiratory droplets from people speaking, singing, coughing, sneezing, so forth. So you want to protect yourself and keep a proper distance away. And we're going to go over a lot of the other stuff. Basically, it could be inhaled into your lungs. You could get it from secondary contacts with surfaces. So, the primary functions of protecting yourself are social distancing, hand washing, wearing a mask, and proper safety protocols as far as cleaning and sanitizing. Definition of close contact, and the basic one is up front, is at least 15 minutes within 6 feet of a person would confirm COVID or direct exposure to some type of body fluid. Now, this close contact pertains to when you're wearing a mask or not wearing a mask, so it doesn't really make any difference. General rule of thumb is the 15 minutes close contact with a person who's tested positive for COVID. Some other means of getting it is shared or eating, drinking utensils, generally at home, direct physical contact, hugging, shaking hands, so forth, kissing people. So those are other concerns you may want to keep in mind. Gave health care to somebody who was sick with COVID. And the key thing to remember is a close contact has to be direct contact with them. A contact of a contact is not a contact. So if I give care to somebody who has COVID and somebody has contact with me, that doesn't count. Just my contact with that person is considered a close contact. Some of the other ways you want to be cognizant of is the surface contact, which we'll get into, the cleaning and the sanitizing. Is how long it's going to last on a specific surface. And if you look at the screen, glass is 5 days, wood 4 days, plastic stainless steel 3 days, cardboard 24 hours, copper surfaces 24. And the key thing to remember is temperature, sunlight, and disinfectant procedures. So it's going to kind of come into place with outdoor play equipment at the younger schools, and obviously on the interior. And the custodians have training with information provided by the CDC guidance as far as sanitizing in these types of situations. Personal protective equipment. The equipment that was provided by the district is face masks. There's also face masks with drapes for people who can't wear, face shields with drapes for people who are medically unqualified from wearing them. Face shields, which is going to protect body fluids from leaving your facial area or coming in contact with your facial area. Rubber gloves for dealing with any type of body fluids. And also remember your bloodborne pathogen training when you should be putting on rubber gloves. And gowns for unique cases where body fluids may be about. And it's a lot of cases with the younger kids or special education where they have to help their children in the bathroom, or adults, younger adults. What's not provided is eye goggles and N95 respirators. N95 is a respirator. It's going to protect you as you breathe in. It's going to filter the intake into your body. It's basically a gas mask in its simplest form, but to be mandated, if you were mandated to wear it, you'd have to be medically qualified. OSHA regulations would kick in, and it required for a medical evaluation and a fit test to be qualified. If you choose to wear it on your own, I'd recommend from your personal health care provider that you make sure you're medically qualified to be wearing that type of device. And again, it's just added protection. It's not mandated. And as you see from the slide, the CDC is recommending that for people who have direct contact with COVID people. So again, it's an option if you want to feel more comfortable wearing it and put your mind at ease, by all means doing it, but just remember, a regular face mask is kind of a nuisance to breathe through for several hours. This will be a little tougher on you, so please keep it in mind, okay? Next slide, protect yourself and others. There's no vaccine. Avoid being exposed to other people. Wear your face mask, avoid close contact, clean, disinfect, wash your hands, social distancing, and those are all self-reminders that you want to be cognizant of. And again, take action when you see a student who doesn't have a face mask. Make sure you offer them one, or inquire what the issue is while they can't, because they may be having some type of medical issue you're not aware of initially. And clean, sanitize, and again, Taking care of yourself takes care of your family, takes care of the students in your class, all at the same time. Key thing is, if you're sick, stay at home. General rule of thumb is, you got to drop the Iron Man or Iron Woman syndrome of, hey, I'm going to go to school, I'm going to teach, I only have a sniffle, I know it's not an allergy, or may have a cough or something along those lines. Best practice is stay at home until you're feeling better, and obviously take your temperature every day before you come in. Same thing for your children before you send them off, and hopefully their parents will be on board with the same type of thing here. So if you're sick, stay home, avoid public transportation, separate yourself from other people, and know your risk for severe illness. If you have a pre-existing medical condition, or think you may have, obesity, diabetes, some type of cancerous treatment, there's a whole variety of them. So if you're at severe risk, be cognizant of it. If you go to the CDC website, it identifies a lot more. And if you go to the Central Connecticut Health District, COVID data, gives you a lot of specific data about specific groups that were higher risk, or the statistics showing who had a higher incidence based on age, based on ethnicity, so forth. And that link is at the back of this presentation. So basically, if you're not feeling well, there's 4 symptoms that are presented as the latest of the key symptoms. Obviously, fever is the primary one. New cough, difficulty breathing, shortness of breath, loss of sense of smell or taste, and that's something that's new. Those are the 4 key ones that you want to key in on. If you have one of those symptoms, definitely stay home from school. Keep your kids from home from school and protect yourself. Other symptoms: congestion, runny nose, headache, gastrointestinal, muscle, body aches, fatigue, sore throat. And this is basically the criteria the nurses are going to be using their assessment when the student comes to them, or an employee. They're going to ask you 1,000 other questions trying to find out if it's a seasonal allergy. Look at your past history. If you just had some athletic event where there's close contact, or you just started working out, the body aches and so forth. So there's a lot of questions for them to ask. They have a big burden on them. So please keep that in mind. The daily self-check. This is what the district expects you to look at before you come to work. The self-check, taking the temperature, looking at those 4 key symptoms plus the other ones. If you're healthy, come to work. If you're not, you're going to have to take the time off. And we're hoping that all the students in the district will do the same thing. The parents keep an eye on them, do this self-test, and not send a sick child to school, as a way to get around daycare, so to speak. May happen, may not, but again, keep it in mind. These are the key things you're looking for. Next slide talks about being quarantined or self-isolation. Key is, individual without symptoms stays home for 14 days. If they had exposure that was diagnosed with COVID-19, and self-isolation is with symptoms or a positive test. So again, there's a deviation between the two. Excuse that. And self-isolation, again, the nurses have this information, quarantine, and again, any further questions, the CDC website, when to quarantine or not, it's very good information to follow. This next one kind of sums it all up: stop the spread of germs. And again, this is, I want to say, the most important slide next to the self-assessment, self-evaluation. Kind of goes over the basic steps: the social distancing, covering your cough or sneeze in a tissue, your elbow, washing your hands immediately afterwards, wearing a face mask covering your mouth and nose, don't touch your eyes, nose, or mouth, clean and disinfect, stay at home, and wash your hands often for at least 20 seconds. In summer school, they had a lot of younger kids, and some of the teachers had a good idea. Basically, if you sing to yourself the happy birthday song, it's about 20 seconds long, and the children can occupy their time and evaluate the 20 seconds. These next slides are pretty much common knowledge, but again, it's just a reinforcement of stuff that you could transfer on to your students to make sure they're in compliance and being healthy and safe. Basically blowing your nose, coughing, sneezing. You see a student doing that, make sure they use the hand sanitizer, wash their hands. Being in a public place, taking care of sick or illness type people. And again, eating food before and after preparing it, changing diapers, using the toilet, touching animals, touching garbage. Again, always wash your hands. And again, simplest form, washing for 20 seconds, and tells you how to wash your hands. Something you already know, but just kind of reinforces when you're teaching the students, reminding them. We're all part of a team here, and we all got to be in compliance. Wearing your mask, and again, some of the key things, wearing your mask, you're obligated to wear it. Make sure you wash your hands before you put it on. Make sure you pinch the top nose bridge if it's a disposable mask. Make sure it's secure underneath your chin. And basically, you're trying to keep it snug as possible without being restrictive to your breathing or to the point of discomfort where you're going to keep popping it off all the time. And again, try to use the strings or whatever attachments you tie behind your head or on your ears. And again, it's got to be an actual face mask or covering. There's no bandanas, gaiters, gangster-like masks. Anything along those lines are not permitted for your safety. And what's highlighted in the red, it's, kind of common sense, but just to reinforce it, children under 2, anyone who has trouble breathing or is unconscious, incapacitated, unable to remove their face mask without further assistance, don't put a mask on them. Use your face mask to help protect others. Like I said, it's more to protect others than yourself. It will protect you, but again, you're trying to minimize the exposure. And some key things, keep it around your face. If it's not, make sure it's in a clean sanitary area. Try not to touch the mask. If you do, wash your hands. And again, a key thing here, this is fairly new in the past 2 weeks or so. Medical exemption from wearing a face mask now requires documentation for exemption from a licensed medical healthcare provider. So again, we have the face shields with the drapes for the students who can't wear them. And again, so it's just not going to be an excuse you don't want to wear it. You got to have documentation for it. Make sure the nurse has it. And you should carry it with you in case it's called into question. And again, taking them off, use the straps, fold it, put it away. Fold the outside corners, put it in the washing machine. If it's disposable, wash it. And again, some of the other stuff that masks that have the exhalation valves on them, they're forbidden to be worn in the schools because you're just breathing the germs back out if there's any in there. So you don't want to wear a mask like that. Next one is the social distancing. And again, depending on which school you're in, organized into cohorts or staying in the classrooms, lunch periods, so forth. And again, the music rooms have a unique set of circumstances given what they're trying to teach and the environment they're in. And if you go to the Connecticut Department of Education, they have a bunch of addendums in there which is worthwhile taking a look at. But the music rooms have specific guidelines, and it'd be in your best interest to follow them, read them, and enforce them. And again, social distance should be practiced with everyday preventive measures. So just because you're social distance doesn't mean you should be out in the public without a mask on if there's people around, so forth. And again, washing hands is another key element here, okay? Some of the things that were done for safe distancing in the hallways is the principle of just guide to the right, walk as close as you can to the wall. All the schools had floor markings put down by security officer Mike Capasso and Todd Lentini. There's a lot of work involved. It took a few days to get all the schools done. So again, they're basically passive reminders to keep 6 feet apart, and you can just be realistic by the width of the hallways, amount of people in there. Do your best to enforce it. If you see kids walking in a clump like they normally do, try to remind them, spread out a little bit, because again, social distancing involves the mask, but it's not one versus the other. It's a combination of the effectiveness on it. And again, the Parks Department put all the 6 foot distancing on the outside, and again, just try to keep that 360 6-foot radius around you, keep everybody safe. And plexiglass barriers were put up in numerous locations for a variety of reasons. Unfortunately, plexiglass isn't really available. It's kind of went the way of toilet paper. Everybody who's had it in demand, and it's almost non-existent to try to order and get it delivered in a timely manner. Social distancing on school buses is going to kind of be wait and see, depending on how many students are riding the buses. Some of the practices that are going to occur is load from the front, working your way to the back, unload from the front, staggered exit times on the buses, so all the buses won't be discharging all at the same time, to be some type of a system in place. And be adjustments made as time goes on. And 2 other aspects of the social distancing, this guidance just came out on the 27th, pertaining to fire drills. And the key thing, remember, fire drill, maintain all your social distancing, everything, the masks and everything in place while you conduct the fire drills. The principals have set up secondary relocation points for conducting the fire drill, so it may take a little bit longer. But again, if they're going to announce the fire drill. If they don't announce it, assume it's a real fire drill. Make sure you safely and expeditiously get out of your building and go to a safe location pre-designated outside. Follow that one. And now for lockdowns, and again, lockdown drills be notified. And again, you're going to do a walkthrough in the classroom. I say walkthrough, a sit-through. Teacher's going to identify points of safety, which they're going to, if it was an actual incident or a normal drill, they're normal times. The kids to relocate, be out of sight of the windows and so forth. So it's going to be more of a training type deal versus a physical drill. And again, if lockdown message goes out, follow the lockdown procedures, because that's more important to your safety than the social distancing aspect of it. Try to maintain your mask and so forth. But again, keep in mind, the drill's going to be announced for a fire drill or for a lockdown drill, but it's not going to be announced if it's the real deal. Cleaning and disinfectant. Key thing to remember here is cleaning. The students can clean. It's soap and water, and you're just cleaning the surface area. You're not disinfecting it. Disinfectant, you don't want the students doing it. That's based on a recommendation from the American Society of Pediatrics for the exposure to the chemicals. Even though they're approved by the state, you still don't want it, because again, take your pick of allergies or reactions that children may have, so you want to keep them out of that. Custodians will be dealing with that. Cleaning high-touch surfaces, restrooms twice per day, and other areas based on need and predetermined needs. And the district's hired, I think, 5 or 6 additional custodians to cover all these bases. So they got a pretty hefty task ahead of them, probably right behind the nurses as far as day-to-day responsibilities and decision-making. Water fountains are being put out of service or being amended with the bottle filling stations. And school transportation buses will be cleaned and disinfected between the runs by custodial staff. After the morning run, the bus company's going to do it. After the PM run, the bus company's doing it. But the in-between runs going school to school, the custodial staff's going to take care of it. The nurses will be given, along with the school administrators, a 30-minute presentation on the medical component or the health room rules. And basically the protocols are that they want you to call before coming down, because they don't want to have an abundance of bodies inside the, I shouldn't say bodies, the students inside the waiting for treatment or be evaluated. So they're trying to minimize it. It just can't be a clearinghouse where a child's, appears to be tired and kind of sleepy, send them down to the nurse, call ahead, advise them what the situation is, and they'll take their advice from what's going on. Obviously, emergency, medical type situation, same protocols will apply. But again, like everything else, you got to change what your practice last year. You can't put it in effect this year without really thinking about it. When you're going to send a student to the nurse, these are obviously kind of self-evident what the new protocols are. Breathing problems, head injuries, different levels of consciousness, sudden vision impairment, so forth, everything that's on the screen. And again, you're not doing assessment. You're an adult. There's quite a few teachers in the district who are EMTs or have some type of medical training. So, always err on the side of caution, but when practical, make sure you call the nurse's station, the health room, for advice as far as how they're going to see them. They're adjusting the medications that they're going to be doing, putting out there. And again, best judgment, what's real, what's imagined with your student, and contact the nurse's office, because it may be a prearranged time, or they may have to come to your classroom. Visitor policy, basically no visitors allowed in the building unless it's required by law. Obviously facilities type personnel, vendors, keep the systems operating, going to go through the sign-in system and all that. But basically parents can't come and go as they planned in the past. And again, make sure you restrict the access under the way you're setting things up. After school activities, and again, this is going to be a big change for people, because you want to teach a certain way, you can't. You want to have guests in the classroom, you can't. You're going to lose a lot of contact with the parents, through your conferences and everything else. But again, you're trying to keep people safe. So again, Zoom meet and social distance outdoors, minimize or eliminate movements within the buildings. And again, it's for safety, but another key component is cleaning. You have 5 kids in a classroom, may be okay for you, but if there's 30 other, 40, 50 other classrooms in the building, and a handful of them are doing it, you're going to throw the schedule of the custodians off to clean and sanitize. They got their regular duties, responsibilities, and all these additional ones. And even though we increase the manpower to them, if you're delaying the cleaning of a room, it's going to knock the schedule out of whack, and you don't want that to happen. So rethink how you're going to run your year this year as far as after-school activities. Next slide. And again, success or failure is based on voluntary compliance. Anytime you put a policy, a protocol, or practice into place, you got to do a follow-up, and you're looking for voluntary compliance. If everybody's wearing their mask, that's good. If they're not social distance, remind them. And again, it's not a disciplinary type thing. It's a training, an educational component. And if all the staff members are on board, the student's going to read that, hey, this is pretty important. If all the staff members are telling me to keep my mask on when I'm in the hallways, when nobody's around, so forth like that, you're going to have success. How are you going to deal with incidents in your classroom? You're going to allow them, again, talk to your administrators about how they want the face mask breaks to occur. But again, it's got to be a team effort in how you're going to support it. And again, the more people who practice it, lead by example, you're a mentor, it's going to work out. Next is my contact information. If you have any questions for me about safety, security, residency, or obviously just COVID compliance, more than happy to help you out. My cell phone's there. And again, the CDC, a ton of information. Check the dates because it changes all the time on that. And again, Central Connecticut Health District, they have same daily updates, but it's basically generally a couple days apart for the statistics. And if you have any questions, please don't be afraid to contact me or your school administrators or the nurses. And hopefully you all have a full year, healthy, safety-wise.